Young baseball pitchers, do you aspire to be like Steven Strasburg? I know some of you do. He has a fast and powerful pitch, but did you know his pitching mechanics led him to needing the dreaded Tommy John surgery?
Proper pitching mechanics are an extremely important task constraint in preventing injury. Strasburg and other famous pitchers required Tommy John surgery because of their faulty technique. Don't let this happen to you. Throughout the video, we will explain to you why proper pitching mechanics are important, and we implore you to change your mechanics if they are off in any way, shape, or form. Tommy John surgery is known as ulnar collateral ligament reconstruction. The ulnar collateral ligament is part of the elbow that allows for bending within a pitch. Below is a healthy UCL, and this diagram shows a torn UCL. In the article Operative Treatment of Ulnar Collateral Ligament Injuries of the Elbow in Athletes, a study showed that during a 6-year period, of 91 athletes that undergone the Tommy John surgery, 85 patients were baseball players. 68 of the 85 were exclusively pitchers. Before the surgery, pitchers reported pain and a decreased velocity in pitches. Pitchers of any age can generate enough force to tear the UCL with improper mechanics. Full recovery from the Tommy John surgery can take anywhere from 12 to 18 months.
More emphasis must be placed on educating young players in the community. The article titled Public Perceptions of Tommy John Surgery explained a study conducted in May of 2012 that revealed a few misperceptions that the public had about Tommy John surgery. Some players, coaches, and even parents believe that pitch type and the number of pitches were not a risk factor for the infamous injury. However, these are certainly risk factors for Tommy John surgery. In another study, 476 players between the age of 9 and 14 were observed for an entire season. The slider pitch was associated with 86% of elbow pain. There was also a significant correlation between the number of pitches thrown in a game or season and elbow pain.
The most important thing to do to prevent a UCL tear is change pitching mechanics, but you cannot stop there and think you're still not at risk. A 1999 study from the Journal of Physician and Sports Medicine titled Elbow Injuries in Young Baseball Players proves that there are many other techniques to prevent injury. Prevention includes stretching, strengthening, conditioning, limiting the number of pitches, and using age guidelines for new pitches. Most importantly, if there is any elbow pain present, you must not try to push through it. Proper rest is crucial in elbow injury prevention. It's important to change the way your body moves mechanically when pitching to prevent elbow injury. First, your body must be directly aligned with home plate. As you can see in the image, Greg Maddux, one of the best pitchers ever, is perfectly aligned with home plate, while Strasburg, on the right, has his shoulders and foot aligned the wrong way, which will hurt his throwing motion.
Next, you must be stable on your back leg when pushing off, and you must have your spine over your center of gravity to stay balanced. The image of Maddux is perfect. You can see in Strasburg's image that his knees look weak and unstable, and he is still not aligned with home plate.
In this image, you see that Maddux is aligned straight toward home plate while it looks like Strasburg is about to throw the ball into the third base dugout. This is going to put harmful strain on Strasburg's elbow when he comes around to throw.
Because Strasburg stepped too far from proper alignment with home plate, he must tilt his chest and head toward the side and drop his glove. This causes his throwing arm to drag in an awkward, painful way.
Finally, you see that Maddux is still aligned with home plate. It looks like Strasburg is about to fall over because he had to compensate for not stepping straight early on his motion. He is unbalanced and at risk for serious elbow injury.
We are targeting you, young pitchers, because now is the time to develop proper mechanics. Later on in your careers, it will be near impossible to change your pitching mechanics. If you don't develop proper mechanics now, then you will be more prone to injury later.
Curtis Jackson. And his first pitch was not great. Just a bit outside. What can you say? Think he opened up a little early?
Yeah,